Definitely continuing with the biomarker-driven therapies. We are understanding cancers at such a deep cellular level. So the ability to target a very specific cell therapy or, driver, and then being able to develop those treatments with that. So it truly is becoming, precision medicine with individualized care. Also excited to see, more targeted therapies, monotherapy, and then we're also combining those with chemotherapy or even our antibody drug conjugates, and also combining with immunotherapy. So we have targeted therapy with the immunotherapy, sometimes throwing in the chemotherapy with it. So just kind of excited to see what outcomes come from that, of those, combination treatments and what we can do for patients. First and foremost, it's always clinical, so efficacy and safety for the patient. So we always want to provide the most groundbreaking, best care for patients. There are areas where we do have multiple treatment options. So if, the efficacy and the safety, the clinical data is pretty comparable between, the different medications, then sometimes we can look at, contracting or the cost to the patient to help alleviate some of that financial burden for them as well. I do monitor the pipeline, me and one of my counterparts. So we're constantly looking at, the pipeline, what's coming down the line, so that we know what to expect. The data that's presented at the big meetings, ASCO, ESMO, ASH. And then typically if it's added into guidelines, or we do get FDA approval, then our Pharmacy and Therapeutics Committee meets every 2 weeks. So we're pretty quick to be able to review those therapies, and especially if it is, groundbreaking and truly the best for patients, then we can typically get them built into our system. Some of the big caveats has been, availability of the drug from the manufacturer. So sometimes if they get that accelerated approval, and the drug's not yet available, we wait to review further information until medication is available to be disseminated to the patients. I know there's a lot coming down. There's a segment about, vaccines. There's multiple different bispecifics, the bispecifics combining them with chemotherapy, and then even them also moving to the frontline setting. And definitely cellular therapies are coming to the forefront. We do have a cellular therapies program that is able to do the induction treatments for these patients. And then we have multiple sites throughout the whole state, and then we're continuing to expand those to just be able to bring that medicine, to people in their homes. Not everybody can travel 2 and 3 hours to go to an academic center. So it is really important that we do have some of these cellular therapies available to the community practice with, the hospitals and providers understanding the side effect management, and if they were to have, CRS, ICANS, infections, knowing how to manage them, because sometimes that can be different than kind of the standard chemotherapy that we're used to seeing.